So first off, what we're going to talk about is just mindfulness and being mindful. Who all has heard of that before, or who all's practiced it? Most people in some form or fashion. So we're going to talk a little bit about um, the roots of mindfulness, where it comes from, different types that maybe different religions do, and then maybe how to incorporate that into your practice. So one of the things that I love is actually flowers. I tell people in another life I might have been a florist. So there are flowers scattered all throughout this presentation. Um, if you're allergic to flowers, don't worry, it's digital. You should be okay. Disclosures, nothing financially. Nobody pays me to do anything. If you want to pay me to do something, please let me know. I'll sit right over here. um, I'm not a certified mindfulness instructor or a Tai Chi master. This is just something that I've picked up, and it's something that has really worked for me over the years. I played a lot of football, 12 years of football, completely beat myself up, got to the point where I couldn't hardly walk anymore, and these are some of the things that are actually keeping me upright, so that's why I've kind of gotten into it. So whenever we do some practice later, just keep that in mind. I'm not an official instructor. Know your limits. Pay attention to kind of how your body feels. So really, all I want to do is introduce you to these topics to hopefully pique your interest and get you more interested in looking into it later on. All right. Learning objectives, we kind of talked about that already. All right. So why should we practice mindfulness and Tai Chi? Well, physicians tend to have a high level of stress. Don't know why. We also have a high level of burnout. Don't know why. But there's quite a few benefits to these practices. One is it reduces your overall stress. It improves your well-being. And it can actually enhance our ability to care for our patients by helping us be more compassionate. So what is mindfulness? So mindfulness is described as being present and aware of the present moment on purpose without any kind of judgment. So one of the things that we tend to do as A-type personalities, being physicians, is we tend to constantly judge all of our thoughts and all of our actions, and we're constantly doing an M&M in our head. What did I do wrong? Why didn't I do this right? This is a space for you to kind of sit and work through all that and just kind of let it go. All right, so here's another flower. Who knows what this one is? Jack in the pulpit, yeah, bonus points. Has anyone ever actually seen one of these before? Yeah, a couple of you. So this one's a pretty cool flower. There's actually flowers down in the middle when you look at the base of it. So I include pictures of flowers in here, one, because I like it and it makes me happy. But two, just to kind of encourage you next time that you're out and you're doing various things, take a moment to pay attention to your surroundings. Take a moment to pay attention to these beautiful flowers that we have all over the place, especially that are blooming right now. So someone points something out about this one that you see that you wouldn't otherwise have noticed. Bueller. Anything? Yep. So she said the way that the flower kind of wraps over and is protecting the middle part there, the flower and the stamen. So, all right, so roots of mindfulness. This is a busy slide. There's a lot of information. I'm not going to read all of these. Essentially, the reason I put all these on here is to point out the fact that many religious philosophies have a mindful practice that they do. So mindfulness specifically comes from Buddhist practice, but then you also have yoga practices, Taoism, Qigong, and even Christianity has a centering prayer, which is a type of mindful practice. So what I like about this slide is our patients are coming to us from various different backgrounds. In the buckle of the Bible Belt here, most of them are Christian. And so if you start talking to them about mindfulness, they're going to be like, I'm not a Buddhist. I'm like, well, neither am I. And so I think it's good to have a knowledge of the different religions and how they practice. And that way you can kind of steer them towards, well, if it's not mindfulness, well, how about a centering prayer? And most of the time they'll say, well, what's that? I've never heard of that before. So you can kind of get them into that practice within their own religion and get them more benefit. All right. So this is my favorite rock band. You guys have heard of Backstreet Boys? These are the Mindful Men. So I got a few laughs. All right. I know it's early. So on the left there, that's Thomas Merton. So he wrote a lot about centering awareness. And then you have Jack Kornfield, who was American-born, decided to go be a Buddhist monk for a while, and then came back to the States and opened up a spirituality center and practice in, I believe, California. Who knows who this guy is? In the middle. Yep. John Kabat-Zinn. Has anyone heard that name before? Some people have, yeah. So he's credited with starting the mindfulness-based stress reduction program, or MBSR. So if you've ever heard of that before, that's where it comes from. Back in like the 70s, 80s, when you see all those pictures of like business people in suits laying on the floor, just relaxing, they're going through the mindfulness-based stress reduction course, and that's what they were doing. He actually has a very, very good master class. If any of you do the master class thing where it's all the famous people that teach, he has one on there that's actually really, really good. Up here, that is Bessel van der Kolk. He wrote the book, The Body Keeps the Score. Is anybody familiar with that one? Anyone read that one? A couple of people have. If you haven't read that book, you really should. It's a fascinating read. So he did a lot of study on trauma and like past experiences and how it affects the body. And what he found was a lot of benefit with truly integrating everything together. So he will do medications, he'll do therapy, he'll do mindfulness, he does EMDR, he does yoga as well. So it's a really interesting what all that he does, but if you haven't read The Body Keeps the Score, I really recommend it. And then down here, and I'm probably going to butcher the name because I'm a hillbilly, but I think it's Thich Nhat Hanh. I hope I said that right. So he is actually Vietnamese, but he's a Buddhist monk. He's known as the father of mindfulness. Sorry if I'm in the way. He's known as the father of mindfulness. He was a prolific writer. He wrote tons of books on the subject. And so there's a lot of information out there between these guys that you can look into. All right, so what are the benefits of mindfulness? So really, if you're looking holistically and looking at the whole body, it affects everything. So mental, emotional, you have decreased anxiety and depression, reduced stress to improve well-being, enhanced emotional regulation. On the physical side of it, you have reduced pain levels and an improved pain tolerance, reduced insomnia and improved sleep quality. Actually reduces blood pressure too. And you have improved digestion and enhanced immunity. And then cognitively, improved attention and focus, better working memory, more cognitive flexibility, enhanced empathy and compassion, and increased self-awareness. There we go. So how does it do that? So, as doctors, we kind of want to figure out how exactly is that working in the body? How is it forcing the body to do these things? So what the research has shown is some pretty interesting things. You have increased activity in the prefrontal cortex, decreased activity in the amygdala, so you're decreasing that emotional response. You actually get increased gray matter volume in the prefrontal cortex and the hippocampus. You increase the feel-good hormones, serotonin, dopamine, GABA, and you decrease cortisol. So everyone talks about cortisol. Doc, can you check my cortisol levels? Well, do some mindfulness. That may take care of it for you. And then increased connectivity between the anterior cingulate cortex of the insula. So it's the two brain regions that are involved with emotional processing and self-awareness. All right, so here's another flower. So somebody point something out about this that you've noticed. There's a bee on it. I'm so glad you said that. So one of the things that mindfulness does for us, so we talk about improving empathy and compassion. Part of mindfulness is kind of figuring out where we fit in everything else. So when we're constantly going around and we're thinking about what I need to get done, what I have to do, sometimes we lose sight of the other things that are out there and how we connect with the rest of the world. So next time you look at a flower, stop and think like, okay, well, how does this connect to everything else? Well, you've got a clear example right there. You've got a bee that's, taking some nectar or taking some pollen from there. So think about that next time you go to squash that dandelion that's in your yard. All right. What are the common challenges to practicing mindfulness? So it can be difficult if you're not used to it. And actually, the first time that you do it, it's going to be extremely difficult. But the more you do it, it gets easier and easier and easier. But common challenges to think about are seeming lack of time. You're going to think, okay, I've got a ton of stuff to do, and now I'm going to sit here for 5 minutes and do nothing. So it's kind of hard to wrap your mind around, but the more you do it, the easier it'll be. Any kind of distractions, both external or internal. So that could be if you're in a busy office space and there's a lot going on, or it could be your own internal issues such as different aches and pains, things like that. Creating the habit. So these things are better done when you do them every day, or have better effect when you do them every day. And so if you don't get into that habit of it, it's harder to do. Some people will really have an aversion to it. I've had someone ask me, well, what are the spiritual implications of doing this? And I said, well, really none. We're just breathing. So that's something you might have to work through in your own life, but also with your patients. Clinging to thoughts. If you have trouble letting go of thoughts, mindfulness is all about letting go of those thoughts. If you have trouble doing that, it may be a little harder for you. Drowsiness. First several times I did mindfulness, I was snoring. You could hear me next door over because I'm always sleepy. And that was something that I had to figure out how to be relaxed but alert, which is kind of hard to figure out. Skepticism, boredom, and any kind of discomfort at all. If you're experiencing those things, it's going to be hard to kind of focus your mind. Okay, so ethical considerations. So this is a busy slide. We're not going to discuss all of this. Appropriation, that's something that you hear about a lot. Essentially, to me, I just consider this as being respectful. So be respectful of the material. Be respectful of where it's coming from. If you're practicing in a certain way, so if you're practicing mindfulness, understand the Buddhist background that's with it. If you're practicing a centering prayer, understand that that's coming from a Christian tradition. So really that's what that means, is being respectful. Consent. Don't just force your patients to do this, because it can bring up some unwanted feelings and emotions. And I've had patients who have flat out refused and said, no, I don't want to risk it. So always make sure someone consents to this. It's kind of like any other medical procedure. You'd want to set it up the same way. Safety, like I said, intense emotions can be brought up. Make sure you're equipped to handle that. So maybe someone who's a veteran that has PTSD, if you're going to practice mindfulness with them, make sure you're set up to take care of it should they have a flashback or something like that. Integration. So this is the B. Think of the larger framework of everything else that you're doing and where we fit in the world. And then expertise. So should always be facilitated by someone who's trained in it. Like I said, we're going to practice it a little bit later today, but I'm going to do kind of your starting basic stuff. So we should be okay. But when we do that later, if you have any concerns or if you have any thoughts, you're cool to just chill out and hang out and just watch us. Or go get some coffee. We're good with that too. All right. Contraindications, potential complications, patient refusal. Anytime patient refuses to do something, don't do it. I mean, that's pretty self-explanatory. Spiritual concerns, like I said, many patients will have some type of spiritual concern, and they're worried about how this could be construed as them practicing, Buddhism or any other practice, Qigong, whatever. Usually what I tell them is we're just breathing. We're not actually focusing on any particular religion whatsoever, but some really do have concerns about that. Physical limitations. A lot of the practices are seated, but some of them are more active, like your yoga or your Tai Chi. If people have physical limitations, that can keep them from practicing this effectively. And so sometimes it's just a little adjustment maybe in how they're sitting to make them more comfortable. Psychosis. If they're in a psychotic state, don't try this. So there's medications for that. Overwhelming emotions, like we talked about, and actually severe depression. I usually will not do this for people that are severely depressed. That's your medicine. If they're mild, maybe moderate, this is something that can really help out for them. But if they're severely depressed, that's when they need the medicine. And maybe get them on the medicine, get them a little better, and then try this. Overemphasis on individualism and self-reliance. I have had some people that think that they're going to do mindfulness and take over the world. Mindfulness is about trying to connect with yourself and everyone else. It's not about how can I get an edge on somebody else. All right. So how can you fit this into your busy daily routine? First step, start small. When you're thinking, okay, great, now to take care of myself, I got to add another mindfulness practice that's going to be another 30 minutes. You can actually see a lot of benefit with just 5 minutes a day. So it doesn't take a lot of time. One of the things that I do when I get up in the morning, I get in my truck to leave for work, I'll turn on a mindfulness app and I'll do it right before I leave. And then I head to work. So that way I fit my mindfulness in. So leads us to the next one. Choose a time and place. Somewhere that's nice, quiet, comfortable that you can sit in. I've got nice leather seats in my truck, so it's a nice, comfortable environment. There's nobody else out there. Everyone else is asleep, so I'm the only one in my garage. So find a good place to do it. The really, really hard part, being patient and non-judgmental with yourself. Sometimes as doctors, we are not very patient, and we tend to judge ourselves very, very harshly. We can be our own worst critics. We have to try to get ourselves out of that. But that's where this practice can help, is by helping us get rid of some of those judgmental thoughts that we have. Okay, so how do you practice mindfulness? So essentially you could break this up into two different things. One is your kind of still practices, and one is more of your active practices. So your still practice could be something like mindful breathing. Could be a body scan when you're laying down at night. A number of other things. Your movement practices could be things like yoga, Tai Chi, where you're paying attention to the movement as you're doing it. Walking can be considered a mindful practice as well. All right. So on that note, how do you practice mindfulness daily? So rather than, or in addition to, having a set practice that you're doing, one of the ways to incorporate mindfulness, aside from looking at pretty flowers as you're walking by, is to stop during normal activities and focus a little more. So that could be something like mindful eating. So that's the strawberry. When's the last time you sat and ate a strawberry and really paid attention to what it looked like or what it smelled like? Has anyone done that recently? I'm like, man, that's a good strawberry. We got a couple of people. Okay, cool. So you can turn, anytime you sit and you eat, you can turn that into a mindfulness practice. So as far as like building that habit in your daily life, if you can stack that habit with something you're already doing, and we already eat 3 times a day, some people 6 times a day, turn that into a mindfulness practice. So next time you do that, pay attention to the strawberry. Look at the ridges that are there with the seeds. Pay attention to the feel of the berry. Pay attention to the colors. Anyone ever notice how many different colors are in a strawberry? I mean, you've got red, you've got yellow, you've got some white, you've got green, you've got lighter shades of green, darker shades of green, maybe some browns. Never really think of that before. Take some time, just a couple of seconds, doesn't take a whole lot, to just stop and think about those things. The next would be mindful walking. This is one of my favorite things to do. Get away from everyone and everything and just get out in the trees and just pay attention to nature and see what's going on. So next time you go for a walk, pay attention to all the sights, the sounds, the feels. What does the ground feel like as you're walking? What's it feel like under your feet? What feelings are you feeling? Is there a breeze blowing? Is it cool? Is it warm? What sounds are you hearing? Do you hear the rustling of the leaves? Do you hear animals? Do you hear owls? I love owls. So whenever I hear one of those, I'm all in. Okay, who wants to practice? Anybody? Okay, so I'm going to grab a seat here. Okay, so what I want everyone to do while you're sitting, you want to sit comfortably in the chair, feet flat on the floor, palms either down or up in your lap, and you want to be relaxed but not rigid. And so you can either close your eyes or you can just focus down on a spot in front of you. And you're going to start with the feeling of sitting in the chair, what the ground feels like under your feet. And now you're going to draw your attention and your awareness to your breathing. So feel the rise and fall of your chest and abdomen. Notice the sensation of the air as it enters your nose and fills up your lungs. If there are any distracting thoughts or sounds, that's okay. Just tell yourself we're going to go back to our breathing and focus on that for now. And then we're going to sit with this for about another 2 minutes. If you feel like you need to move and adjust to be more comfortable, that's okay. Okay, and as we bring this practice to a close, you're going to make note of that calm relaxation and take it with you throughout the rest of the day. And so when you feel ready, you can open your eyes. So, what did everyone feel about that one? How did it make you feel? What'd you notice? Sleepy? Slowed down the caffeine heart rate. That's probably a good one. Anybody else have notice anything? Maybe any aches and pains that maybe went away? Anything like that? What's that? It was hard. Yeah. So it can be very, very difficult, especially as you first start doing this. But the more you do it, it's a practice like anything else. The more you do it, the better you get at it. And so what you'll notice is the more regularly you do a mindfulness practice, the more quickly you drop into it. So take that with you. If that's something you're interested in, look more into it. I'd really encourage you to do that. All right, so we'll move on here. Haha, who knows what this flower is? This is a beauty. Who knows what it is? A detox, yeah, there you go. It's a dandelion. When's the last time you stopped and looked at a dandelion? One of the most beautiful flowers on the face of the planet. And we're like, that damn weed, it's in my yard again. So then we spray Roundup on it like he was talking about last night, and we're killing ourselves. Next time you see a dandelion, you're going to stop and think, well, he said I ought to take a look at it. Beautiful, beautiful flower. All right. So now we're going to talk a little bit about Tai Chi and how that pairs with mindfulness. Has anyone practiced Tai Chi before? Yeah, we got a couple. Okay. I love Tai Chi. So like I said, I played football for 12 years, just completely beat myself up. Had to quit because I couldn't walk anymore. And when you get to the point where you're getting depressed because you feel locked into a body that won't let you do anything, you will try anything. And so it was great when I went to medical school because I was around a whole bunch of DOs. So like Chris Yance, I'd get him to work on me and I'd feel great for months. Well, then I get into residency and there's not really a lot of people that are doing OMT. So then it's like, okay, well, how do I work on myself? It works sometimes. Sometimes it doesn't work. So then I came to Tai Chi. And this is something that I can do. I don't have to kneel down in the floor. I tore a ligament in my knee trying to do yoga. And cat-cow, one of my favorite exercises, can't do it anymore, which is very much a shame. But Tai Chi, I can still do, even with all my issues and all my injuries. So that's how I've come to love it so much. What many people don't realize is Tai Chi is actually a martial art. How many knew that? Oh, yeah, a fair few people. Good. So it's actually a martial art, teaching people how to do graceful movements, but what it's doing is it's teaching them muscle memory for fighting. So that's one of the things I love about this is, you're learning to slow down and relax and take care of yourself while hurting somebody. So it's always a good thing. But it's designed to promote physical, mental, and emotional well-being. So evidence-based benefits, because it's always important. What's the evidence? So improves balance, flexibility, and strength. Can also reduce symptoms of anxiety, depression, and stress. Improves cognitive function and memory. Lowers blood pressure and improves cardiovascular health. Increases energy and vitality. So a lot of overlap with mindfulness. So it's probably hitting a lot of the same areas. One of the other things that I really like about Tai Chi is it's a very simple exercise that most anybody can do at kind of any fitness level. And the research is showing whether you're walking for an hour or doing Tai Chi for an hour, you get the same benefit. So you can actually see improvements in strength. You see improvements in bone density because it is a weight-bearing exercise. So very, very good exercise. All right, so how does Tai Chi help us cultivate mindfulness? So same thing, we're trying to be present in the moment. So as you're going through doing very slow, gentle, easy motions, you really are having to put your mind on your body and figure out and think through all of those things. So by doing that, we're slowing down and we're paying more attention to our bodies. And try to do it without judgment. what I love about what I love about Tai Chi is it will teach you don't go above 70%. So if you can do 100%, or if this is your 100%, only ever go to here, because we don't want to risk your body saying, whoop, nope, don't want to do that, and then spasming something. And I'm guilty of doing that all the time, because I'll do this and I'll start feeling better and I'll think I'm 20 again, and my body promptly tells me I'm not. So, but then we can it actually has a profound impact on reducing stress and anxiety levels as well. Okay, so there's different ways to practice Tai Chi. One is the slow flowing movements that everybody is aware of and everybody knows. But it also has different meditation practices that you can incorporate into it. And Qigong, who's done that before? A couple of people, yeah. So this is it's a series of like breathing exercises that you can incorporate into it that has shown a lot of benefit too. All right, same thing. How do you incorporate it into your daily life? Again, start small. Choose a good time and place to do it. And be patient and non-judgmental with yourself. You're not going to get it right away. It's going to take time to learn and get your body accustomed to it. All right, so daily Tai Chi. So one of the things I recommend to people is breaking it up into 3 times a day, because exercise is cumulative. So you don't have to do it all in one go. And I don't know about you, but I don't have an extra hour in my day, a whole hour to sit and do something. So I usually say start with a morning routine. Wake up, do a 10, 15-minute Tai Chi calisthenics, which is like a warm-up exercise, which I'm going to show you guys here in a little bit. And then during your lunch break, if you've got 10, 15 minutes, either do more of the calisthenics or do a couple of the movements with Tai Chi. And then at bedtime before you go to bed, you can either add in more of the practice, or that's where you can add in some of the breathing exercises that come along with it. All right, who wants to practice Tai Chi? All right, everybody stand up, or whoever wants to stand up can stand up. Whoever doesn't want to, have a seat. I'm in Tennessee, boy. It's okay. I go there. So what I want you to do is notice the sensation that your body has of just standing there. Pay attention to any ebbs and flows of fluid that you may notice. Pay attention to any tense spots that you may have. And then what you're going to do is just very gently bend your knee from one side to the other. It doesn't have to be a very large motion. Just a real nice, easy, gentle motion. And remember that we're mostly water, we're mostly liquid. And so imagine that you're gently pouring that liquid back and forth. So we're trying to keep that liquid from sloshing around too much. And then when you feel comfortable, you go to the side, we're going to add a little bit of a turn to it. Don't strain your knees, don't strain your hips. Do what you can. Like I said, only ever do 70% of what you feel like you can do. You may feel like you need to do a little more or a little less, that's okay. And we're going to pick it up just a little bit. Start swinging the arms, just kind of loosening up everything in the body. You're actually going to start tapping up by the chest, under the thigh. next one, oh, I love this one. Spinal cord breathing. So you're going to hold the arms up to the sides. And I usually recommend doing kind of a yoga pose where you tuck your tailbone under, hold the abs tight, because you balance your core a little better doing this. And so what we're going to do is we're going to do a movement where we're back and forth. And we're going to stretch the spine. What I don't want you to do is lean forward. I want you to just kind of tuck and roll very gently. So if I'm saying go 70% with the spine, we may want to protect it a little more. You may only want to go 50% of what you can do. Go out, up. And just feel each of those vertebrae as they gap and expand and open up. Making more room for the guest. You want to hold some breathing into this, you can. Come back out with the chin, feel it stretch the front of the body, and then back up. A couple more of these. So when we come to the end of this one, we're just going to let our hands fall, kind of like a leaf that falls to the ground. And we're just going to roll up one vertebra. And then just pay attention to your body, the sensations that you're feeling with that. And so the next one that we're going to do is called simple breathing. So what you're going to do, arms down to the side, and as you take a breath in, you're going to pull the shoulders up. It doesn't have to be very far. Go as far as you're comfortable with, and then breathe out. Okay. This is great if you have shoulder issues. It just helps mobilize that scapula. Helps mobilize the clavicle. Helps open and expand the rib cage as well. Do that 2 or 3 more times. Nice, slow, easy motion. Don't worry so much about how many we're doing. Focus more on what the sensations are like in your body. You need to go faster, you need to go slower, that's okay. Go at your own pace. The next one we're going to do is called the fountain. Or actually, no, wait. Yeah, the fountain. I skipped one. No, I didn't have one on there. I'm going to do this one because I love it, because I love the name of it, but I also love how it stretches the spine. It's called the dragon wagging its tail. Love the name. You're going to hold the hands in the front, and you're just going to gently lean to the side. And you're going to feel that stretch all the way from your ankle up to your ear. And then back the other way. was that? All right. Just some resources for everybody. Two of these are free. If you want to learn more about mindfulness, there's a website, Palouse Mindfulness. This is actually the MDSR course that John Kabat-Zinn has done, but it's a self-paced course that's completely free. So it's great for you, great for your patients. Mindfulness Coach here in the middle. It's the blue background with a leaf again, me and my flowers. This is a great app. It's completely free. This was actually done by the VA, so the Veterans Administration, to help veterans with PTSD. What I like about this one is it will actually teach you about mindfulness as it also teaches you how to do the different practices. And then the exercises that we just did were based off of this book, Harvard Health Tai Chi. It's a great book, but if you just want to go straight to the practices, they have YouTube videos. So if you get on YouTube, you look up Harvard Health Tai Chi. There's the calisthenics, which is what we just did, and then the actual Tai Chi practice, which is called Tai Chi Elements. So if you want to look more into it, those are some resources for you. And then, my favorite part of the whole presentation. Who knows what this is? Irises. They're blooming right now. Yep. My favorite flower in the world. If you ever want to give me anything, give me some bulbs. I'll be happy. So, who noticed something about all the flowers in this presentation? What's that? They're all blooming. They're all native Tennessee. There you go. I'll leave you with that one. Yeah, forward back.
Okay, so I'm going to be just expanding a little bit more on some practices that we can do for self-care and some centering practices, things that you can hopefully use on a regular basis, just like Tyler was just talking about. Okay, so self-care in general, just like our osteopathic tenets, it should include practices for the body, mind, and spirit, okay? So a lot of times we think about taking care of ourselves as just diet, exercise, get a good night's sleep. But we should also make sure that we take care of our mind and spirit as well. So we're going to go through all of that, body, mind, and spirit. We're going to overview some practices that you can include into your daily regimen that hopefully can help maintain your optimal physical, mental, and spiritual wellness. And I'm going to give you some examples to finish up of some practices that hopefully you can use regularly. Okay, so like I said, basic self-care, most of us think of just getting some adequate physical activity, eating a healthy diet, getting a good night's sleep, and that'll help us just kind of keep going through day to day. So I'm going to start with going through some of that. How can we get those three things at least? So these are kind of the CDC recommendations that I'm sure you guys have all seen. Most of us are in the 18 to 64 category. 65 and over is basically the same as long as you're generally fit. So what they recommend is 150 minutes of moderate intensity aerobic activity. Basically, they say just kind of get your heart rate up, basically a half hour, 5 days a week. And then also some muscle strengthening, 2 days or more a week to work on all the major muscle groups. So that's kind of the general recommendations. I think all of us have, our own kind of regimen. What does that mean? Some of us have active daily lives, and I tell a lot of my patients, who are very active just in their regular lives, 5,000 steps a day can also count for your moderate aerobic activity too. So take this with a grain of salt. If you do sit at a desk all day and you don't get any kind of activity, I would definitely encourage you to kind of push for some of those goals. Make sure that you are doing some kind of practice that picks your heart rate up, because we know that does increase longevity, helps with heart rate variability, and just helps in general with our overall physical health. But there's many ways that we can get that exercise. I do like the strengthening a couple days a week too. Kind of just getting out there and doing a walk can be helpful, but making sure that your body, your core muscles especially, are strong can really help to improve our overall wellness, give us some spinal health, flexibility, and that. Okay, so diet. I mean, there's a billion different diets out there. Patients come into me all the time and they say, what's the best diet to do? Or they bring this, new thing in. I'm doing the ketogenic diet. I'm doing the intermittent fasting. I'm doing gluten-free. What do you recommend? And do you think this is a good thing? This is what I tend to always get back to. This is kind of my perfect diet. I call it the Asian Mediterranean fusion diet. And this is, Dr. Weil created this, and you can go on his website too, and he's got this pyramid interactive, so you can kind of click on each little thing and get a little bit more information on each little piece. But basically, he wanted to reinvent the FDA's crappy pyramid and show us what we should really be doing by collating all of the evidence that we know of for food, because there is a lot of studies that are related to diet and specific foods, that this does better for you, and getting more of this is anti-inflammatory, and this will give you antioxidants. So he tried to take all the research together and put it into one actual diet, one actual pyramid, okay? So, we'll just we'll go through this just a little bit. I think the FDA, I haven't looked at it in years, but the old FDA pyramid kind of started with basically bread, and I hope we all know that bread is not really a staple of our diet, or shouldn't be. So vegetables and fruits are the base of this. It's not a vegan diet, it's not a vegetarian diet, it's definitely a complete balanced diet, but the most foods that we should be eating are fruits and vegetables. You can do raw and cooked. You want to try to get all parts of the color spectrum, because each different color has different vitamins and minerals that our body needs. So when you look at your plate, try to get as many colors into it as possible. That's my mother-in-law's mantra. She tries to make a pretty plate. She doesn't like a brown plate or a yellow plate. But that's a really great way to eat. Try to get as many colors into your plate as possible, and that way you know that you'll be getting all the different minerals and nutrients that your body needs, okay? So 4 to 5 vegetables a day, okay? I guarantee most of us are not getting that. And 3 to 4 fruits a day, okay? Next is grains. So the gluten-free kick is a really big thing, and I do think that gluten and especially breads and flours are very inflammatory. But it is also important for us to get grains. They're important for our gut health, our digestion. They give us a large amount of our fiber. We want to concentrate, though, on mostly whole and cracked grains, okay? Not the breads, not the flours. Get our grains from the whole grains, quinoa, barley, oats, things like that, okay? Pasta you can also have. I mean, pasta is a big part of the Mediterranean diet, and we all know that Mediterranean diet has a ton of research to show its overall health benefits. When you do cook pasta, so pasta is a little bit of a slower burn than something like a bread, just the way that it's made from the durum flour. You want to cook it more al dente, so don't overcook it, okay? Cook it so that it's a little bit more kind of, I guess, on the crunchy side. It'll keep some of the nutrients, be a little bit slower on the digestive tract so that, it'll help kind of burn slower and help with your digestion. Beans and legumes too, lots of protein in this, lots of fiber. Beans and legumes are very important for us to keep in our diet. Next is healthy fats. I mean, fats are a really important part of our diet. There's starting to be some research about Parkinson's and low-fat diets, and people who are avoiding any kind of healthy fats, Parkinson's and neurodegenerative diseases. So fats with our omega-3s are really important. Obviously, all of our cells have a fat cell membrane. The nervous tissue is all lined with fat. So without fat, we don't work real well. You want to get the good fats, though. So extra virgin olive oil, canola oil, nuts, especially the more anti-inflammatory nuts. I mean, I think it was Dr. Bernoulli said yesterday peanuts are kind of inflammatory. So there are certain nuts that are a little bit less healthy for us, but walnuts are especially good. Avocados will also get us a good source of fat as well. Hemp seeds, flax seeds. A lot of people I know throw flax seeds on their oatmeal or their yogurt in the morning. Those are ways to get it. So then we get to the meat part, and fish is the first part. We all know the Mediterranean diet is high in fish. The biggest thing to watch out for fish is there's more and more farmed fish now. It is really important that you look as much as possible that you get a wild-caught fish. You can see in the grocery store when you go to the fish, and especially with salmon, you look at the salmon and you see the wild-caught salmon next to the farm-raised salmon. The farm-raised salmon is almost white, okay? And the reason is because they're not getting those natural, what do they call them? Not the plankton, the little guys they eat that give them the pink. I forget what they're called, but you can see that pink color. They actually add dye to farm-raised salmon in order to make it look like it's, more of a natural thing. But, if any kind of farm-raised food or industrialized farm-raised beef, chicken, any of that stuff that's raised by corn, my mantra is that if it's fed corn, that's what you're eating. So if you want to eat corn, just go get some corn. But any kind of industrialized meat, you want to be aware that if it was fed corn, that's basically kind of what you're getting nutritionally. So wild Alaskan salmon, Alaskan black cod, sardines, those are kind of the top ones that are less inflammatory, much higher on the omega-3s, okay? So kind of look out for those. Soy foods. Has anybody heard research about how soy is bad? We should avoid soy, especially in women, that maybe it raises your chances of breast cancer. Has anybody heard any of that? No? Okay, well, that was a big thing for many, many years. And that was from very small studies where they, and not very well designed, but basically kind of came out as, women especially should not eat soy foods. Anyone who's had breast cancer should avoid soy foods because soy has isoflavones, which are basically a plant estrogen, okay? So there was this theory that they were pushing breast cancer, and this study kind of maybe saw that it increased breast cancer in women. That's really been completely debunked. There's been many large studies now, meta-analyses, especially with Asian women, because obviously they have diets very rich in soy that have debunked that at this point. So if you have been telling your patients avoid soy, especially breast cancer patients, it's actually anti-cancer, so it actually helps to prevent cancer. So I would encourage soy products in an organic form, a whole food form, okay? So a lot of you probably have also heard that soy is not great because there's so many processed forms of soy that are in our foods, and those aren't great. But whole food soy, such as edamame nuts, those are things you can kind of grab and eat throughout the day, little snacks. Soy nuts, soy milk. Soy milk is a really great little thing you can give to your perimenopausal women. Say, have a glass of soy milk at night, because like I said, it's a weak kind of plant estrogen, so it does kind of just give that, especially for women, that calming feeling. So it's kind of like a glass of milk before bed, but that soy gives us that kind of estrogen release and relaxation. So that's something you can recommend. Cooked Asian mushrooms. So Asian mushrooms especially have many medicinal properties. So adding mushrooms into your diet, especially the Asian mushrooms, can be very anti-inflammatory and medicinal. You want to make sure to cook them because mushrooms have been shown in the uncooked form to create a little bit of toxicity in our body. So with just light cooking, light saute, give us the medicinal properties that we want, okay? So not those button mushrooms, but the funky looking Asian mushrooms are the better ones. Okay, so then the other sources of protein are kind of higher in the pyramid, so a little bit less. Our SAD diet, our standard American diet, the meat's kind of down at the bottom, So we do want to do a little bit less of the meat, but we want to include meat. So again, I don't advocate vegetarian, vegan in any way. I think we need a balanced diet, but a little bit less of the protein. So here, I mean, I would say probably most of us eat meat 2 to 3 times a day, okay? So this is kind of a lot less. So your meat, including eggs, poultry, lean meats, would be more like 1 to 2 times a week, okay? And then the fish being a little bit more of an improvement. Yep. Yeah. I would respectfully disagree with that, but I mean, I think there's so many different types of diets, but in my personal experience with patients, even healthy vegans and getting those supplements tend to not be quite as healthy as a full overall well-balanced diet. And I would say that this diet is all evidence-based, and everything in here comes from, as much studies, meta-analyses, large randomized control trials. So in general, I would push away from the vegan vegetarian diet. Right, I agree. I would disagree with that data, but again, there is definitely a lot of controversy. I mean, I've had many debates with many people on a lot of this. And even with the meat part, I honestly, for myself and my patients, because a lot of these studies, as far as like 1 to 2 times a week on the proteins, these studies are a little bit skewed because most of these studies include industrialized beef and industrialized poultry. There's very few studies that include, farm-raised Wagyu beef. That is what we really should be eating. So there is a lot of controversy on that. If you have a farm-raised cow that ate grass in your own yard, is that different than the Omaha beef that's in a lot of these large studies? Okay, but in general, I mean, there's a ton of controversy still. This is the diet that I tend to recommend because it is kind of the most evidence that we have to this point as to what's going to get us better health and better fitness. Okay, and just a few more things on this. So healthy herbs and spices. If you're the type that just cooks with salt and pepper, try to expand your recipes. Try to throw in herbs and spices. They're all basically medicines. Ginger, turmeric, cinnamon can really add just a little bit of medicinal quality to our food. Okay, food is medicine, and it should be. Tea. Try to get a couple of cups of tea a day. Tea is also basically herbs. It's medicinal. So add a little bit of those antioxidants into your daily regimen. And then supplements. So if you're not getting the bottom of the pyramid, you can supplement it. Take some omega-3, take some whole food multivitamins. Try to get some of these minerals that you might be missing, okay? And then the top, you can take it or leave it. Red wine has been shown to have some antioxidants. If you are gonna do wine, it should be earlier in the evening with food, not, 5 glasses late at night. Okay. And then if you're going to do dessert, it really should be kind of sparing plain dark chocolate, something that's going to give you some antioxidants. Okay? Okay, so sleep. So mental health issues such as anxiety and depression are definitely strongly linked to insomnia, and I think a lot of us struggle with insomnia with the stress that we go through on a regular basis. Okay, so this is kind of what I go through with my patients, and a lot of times I'll give it to them and they'll say, I've tried all these things, it doesn't work. And I say, just make sure that you kind of go through this and see if you can find something new that maybe you weren't doing before. And most of the time they'll come back and they'll say, you know what, you're right. Just really concentrating and paying attention to all these different things can help just get a better night's sleep. Okay, so number one, make sure you ritualize your rhythms of activity and rest, okay? So try to create an energizing ritual in the morning. Exercise first thing in the morning, probably the best time to exercise. Get some morning light, open the shades up, get the actual daylight in, okay? Learn to rest during the day with some meditation and breathing practices. Try to get into the habit of coming back down into that parasympathetic cycle, okay? Try not to keep yourself up at that sympathetic, constant fight or flight tone throughout the day, because then if you try to get down to that parasympathetic when you've been 12 hours up here, it's going to be a lot harder to get down here, okay? And then develop a soothing evening ritual as a bridge to sleep, okay? Whether it's breathing exercises, meditation, just kind of sitting quietly, reading. Try to slow yourself down a little bit in the evening, okay? Also, use the dusk and darkness as a sleep medicine. So simulate dusk a couple hours before bed if you can, even just a half hour. I just ask a half hour at least. Try to turn the lights down in your house. Try to slow things down. Try not to be watching TV and on your computer right before you go to bed, okay? Try to slow down those lights. You can also do some things like take a warm bath, journaling, rest practices, yoga, things like that, just to kind of slow yourself down in the evening. Quiet your body noise. So avoid caffeine, sugary foods. Try not to eat late. I try to encourage people to finish eating and drinking, or at least stimulant drinking by 6 p.m. if you can. And that sounds kind of crazy, I know. But if we try to make that our goal, hopefully we can get towards that. But give your body that time to digest. Give your body that time to release that caffeine, that sugar, before it needs to slow down and go to sleep. Make sure you check any sleep side effects on your medications too. And alcohol intake, again, make sure that you drink less and earlier, and make sure it's with food, okay? Create a sleep sanctuary. Okay, so no TVs in the bedroom. Make sure it's really just about sleep. Try not to make your bedroom your office or a playroom or anything but your sleep sanctuary. Try to keep it cool at 68 degrees. Make sure, try to get as organic as possible, natural cotton sheets, less chemicals that you're inhaling. Get the electric clocks and the phones away from your head, like Dr. Bernoulli was talking about yesterday. Keep those Wi-Fi signals and the Bluetooth all away from your head, the clocks with the stimulating light. Okay. And then learn to surrender to sleep. So avoid that chemical knockout of sleeping pills. All of the sleeping pills, prescription sleeping pills, are hypnotics. They kind of knock you out, but they're not really giving you that deep REM rest and sleep that your brain and your body needs. Try to let go of waking. This is kind of a practice that will take time, but the more you do practices like Tyler was talking about, the easier it might be to just kind of tell yourself, I'm not worried about telling myself to go to sleep and telling myself it's not going to happen. Try to just let go of those thoughts, okay? Try to make it more of a personal spiritual practice, almost an act of faith, okay? This is going to happen for me. We're going to get to sleep. You can also use natural sleep aids like valerian, lavender, just to help to rest your nervous system a little bit. Okay, and try not to battle nighttime wakefulness. So only go to bed when you do feel sleepy. Never watch the clock. If you can't go to sleep, sit in a comfortable spot until you do feel sleepy again. Don't just kind of lay there and then just think about everything that you need to do tomorrow. Get yourself up. Try to do some kind of relaxing practice. Just sit until you feel sleepy again. And then again in the morning, arise mindfully with intention in the morning, okay? So it's all about schedules, circadian rhythm, getting ourselves into a regular rhythm. Get at least 20 minutes of daily exposure to morning light after getting up, okay? So if you tend to get up before the sun comes up, that can be hard, but if that's a problem for you, maybe get some of those daytime lights in your house and flip them on first thing in the morning. Try to get up slowly, explore your grogginess. Try not to make it to the point where, you only have 20 minutes before you have to be to work and you're rushing through in the morning. Try to just kind of move slowly and get yourself ready as you need to. Okay. And take this time to even kind of think about did I dream last night? What did I dream about? And just kind of reflect on some of those things. And set some conscious intentions for your day. Okay. So hopefully some of those things will help you guys get a little bit better night's sleep. Okay, so we're going to go through some centering practices, okay? Tyler went through a little bit of mindfulness, okay? That's one practice that a lot of people use. There's different breathing exercises that you can use, progressive muscle relaxation, and we're going to go through some of these so that you can experience them and see how they're used. And then some meditations. Okay, so Tyler did a lot with mindfulness, so I won't get too into it, but basically mindfulness is paying attention in a particular way on purpose in the present moment and non-judgmentally, okay? So just try to practice that throughout the day whenever you can. You know, when you're in the grocery store behind the old lady who's trying to rifle through and find her check and then has to run out to the car because she brought the wrong checkbook, try to just be mindful, present, non-judgmental. Don't get yourself all worked up. It's only going to hurt you. Okay, so we're going to start with my favorite breathing exercise. This is called the 4-7-8 breath. So basically it's 4 in, 7 hold, 8 out, okay? You're going to close your mouth and inhale quietly. You don't have to do it yet. We're going to do it together, but close and inhale quietly through your nose to a mental count of 4, and try as much as you can to just do a slow 4, and I'm going to do the counting for you too. Hold your breath for 7, and then you're going to exhale completely through your mouth, making a whoosh sound, okay? You may sound or feel silly, but you really want to kind of push that air out and feel it pushing in your abdomen, okay? And you're going to do that for a full count of 8. Get out more than you bring in, okay? So this 4-7-8 is one breath. We're going to repeat this 3 times, okay? This is one of my favorite things that you can do anywhere, anytime. You can do it between patient rooms, okay? If you start feeling your heart rate running, you feel like your mind is running, and you just really need to slow yourself down, you can do it anywhere, anytime. Nobody will even know you're doing it. And it can really just kind of pull you out of that. Can anybody tell me what the 2 things are, or at least the 2 that I know of, that are run by our automatic or autonomic nervous system, and we also have manual override for? We can control ourselves. Anybody tell me the 2 things? Breathing, yeah. That's a gimme. And the other one's blinking, okay? So we know, you know, the parasympathetic, rest and digest, and the sympathetic, fight or flight. They're that kind of, the different things in there, the, you know, dilated pupils, the fast blinking, the tight muscle tone, the ready to go, the heart rate going. All those things run together. There's only one pace. You're either in slow or you're in fast when you're in either one of those shifts. Your body and all those different systems can't run at different paces. Your heart rate can't be running fast while your breath is calm and even, okay? So if you set your own pace, you also pull those other things along with you, okay? So I call it my manual override, okay? Use that breathing to reset that heart pace, reset that running energy, okay? Your nervous system cannot run on 2 different paces. It can't have different pieces in different rates, okay? So use this breathing to pull yourself out of that sympathetic fight or flight anytime that you need to, okay? And hopefully using this can kind of help you do this at any time during the day. Okay, so we're going to try to practice this. We're going to do 4 cycles, and I'll count for you. It's very hard at first, I can tell you. Most of us don't breathe deep enough on a regular basis. Holding it for 7 and pushing out for 8, if you haven't done this, is going to be hard. So don't get upset with yourself if you can't do it. Just do as much as you can, okay? All right. So we're going to start. I want you all just to put your feet flat on the floor if you can. Try to just feel comfortable and relaxed. And we're going to do breathe in 4, hold 7, breathe out with that whoosh sound for 8. Okay, ready? Inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. 2, 3, 4, 5, 6, 7, 8. Relax a second. We're going to repeat. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. 2, 3, 4, 5, 6, 7, 8. Relax a little. Inhale, 3, 4. Hold, 2, 3, 4, 5, 6, 7. 3, 4, 5, 6, 7, 8. One more. Inhale, 2, 3, 4. Hold, 3, 4, 5, 6, 7. Exhale, 3, 4, 5, 6, 7, 8. Okay. Did anybody notice, especially the first or second maybe, hold that they did? Did anybody feel that kind of shift or transition of the heart rate? Maybe if you were on that kind of caffeine high, anybody feel that at all? No? Maybe that's just me. Sometimes you can feel it as almost just a downshift right away. So like I said, the breathing is our manual override. Use it as much as you can. It can really pull people out of panic attacks or just that kind of run, run, run feeling that we get through the day. Okay, good. Okay, so now we're going to do a progressive muscle relaxation technique, okay? This is something you'd probably want to get a quiet room for, or even a closet, the bathroom, anywhere you can get your truck. And it just takes a few minutes, and you can do this without any assistance. So we're going to practice this. I'm going to teach you how to do it. I do recommend that you don't have distractions. So if you don't have a completely quiet space to go to, like your truck or something, maybe play, close the door, play some meditative music just to block out ambient noises, just to kind of keep yourself from, going to those spaces. Okay. So if everybody can just sit comfortably in your chair, feet flat on the floor, put your hands just on your legs or on your abdomen to feel your breathing, okay? And we're going to do this progressive muscle relaxation. Okay. And if you feel comfortable, you can close your eyes. I want you to begin by taking a deep breath, noticing the feeling of air filling your lungs, and hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another breath and hold it. Again, slowly release the air. Even slower now, take another deep breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Now move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to the tension and notice what it feels like. Release the tension in your foot and notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves, hold them tightly, and pay attention to the feeling of tension. Release the tension from your lower legs. Again, notice the feeling of relaxation. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel the tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze harder and hold the tension. A little bit longer. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold it. Release the air slowly, feeling it leaving your lungs. Next, tense the muscles of your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body, and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm. Hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension. Again, notice the new feeling of relaxation. Finally, tense your entire body. Tense your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold the tension. Now release. Allow your body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Begin to wake up your body by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. Okay. So that's a practice that you can do. Like I said, go in your office, shut the door, only takes a few minutes. You don't need the meditative music, but it can help just block out the phone calls and everything else going on outside. You don't need an audio, you don't need assistance. You can just do it in your own head. Start from your feet, move all the way up your body. So it's something that you can do anywhere, anytime, and can really be helpful to just release a lot of that muscular tension that we build up through the day. Okay, so now we're going to move into meditation. So meditation's a mind-body practice. It has a long history, like Tyler was discussing, thousands of years. Used for increasing calmness and physical relaxation, improving psychological balance, coping with illness, enhancing overall health and well-being. So how does meditation benefit health? Primarily, meditation practices appear to be a general shift in the autonomic nervous system, okay, that fight or flight to the rest and digest. Decreases sympathetic tone and increases parasympathetic tone, okay? Most of us are running way too long in that sympathetic tone all day. As the parasympathetic system is stimulated, our heart rate and breathing slow, our stress hormones decrease, blood vessels dilate, and digestion is facilitated. So there's always been a lot of debate. What is conscious? What is unconscious? What is our subconscious? What's the ego, the superego, the id? You know, what are all these things, and what's going on in that brain that we can't kind of access? There are, you know, a lot of controversy about what this is. Functional MRI is, you know, kind of an objective to look at what's going on with brain activity. So there's been some new studies to look at the resting brain, the subconscious, the unconscious brain, and they have shown some underlying activity levels that are actually higher than the task-oriented brain. So there's definitely a lot going on in that subconscious that we don't really have access to. So meditation really is, in general, the theory is that we're trying to tap into that subconscious, that unconscious, and hopefully make some change. These are just a few different types of meditation, and I start with kind of what people see as, what my patients see as kind of the hard ones. Like, there's no way I could do anything like that. I'm not a Buddhist monk. I can't just sit there and just zone the world out. And I don't think any of us ask you to start from there. You know, think of yourself as a kindergartner. We're going to teach you some practices to start in kindergarten. And if you want to get to the point of a Buddhist monk, great. That's going to take you thousands of hours. But don't try to start at Buddhist monk and say, I can't do that, forget it. So different types, transcendental meditation, you know, a lot of us can't wrap our brains around that. Focusing on a mantra, trying to transcend our you know, mind into this different space. That might not be something that we can all just kind of start with. Zen meditation is the Buddhist tradition. It's basically kind of focusing inward into yourself, trying to get rid of all of the excess distractions in the world. So walking meditation, we're kind of going a little bit more towards the meditation for dummies or meditation for beginners. But Tyler spoke of walking meditation, and it's basically a slow walking with a focus and a coordinated breathing, okay? So start with something like this. Go out for a walk. I would encourage, if you do a walking meditation, not to do it, you know, on the sidewalk outside your office where you might run into people, because you don't want to be interacting with people. You don't want to be having conversations. You want to be trying to focus on your steps, focus on your breathing, focus on the natural environmental sounds. I have a friend whose son just signed a D1 contract for golf, and she said that he would, in between from one hole to the next, he would count his steps and just focus on his steps. And that's what kept him able. I mean, golf is probably one of the most neurotic sports, but you know, that's kind of a walking meditation, just counting your steps, focusing, bringing yourself inward. Okay, and finally, guided imagery, which is my favorite, meditation for dummies. Guided meditation is using an imagery in a peaceful setting, focuses the imagination in proactive and positive ways, okay? So usually it's done with an audio, an assistance. You can do it on your own if you feel like you're, you know, more practiced at it. But listening to an audio that's focusing on kind of bringing you to a peaceful place and speaking of things that might help to get into those kind of subconscious triggers and why do we do these kind of anxiety-ridden things, and try to make some change in those subconscious practices for the good. So these are some resources that you can use. I know Tyler gave you a couple different things. You can pull up some of these resources and get some of these meditations, get some practice, use it at home. Health Journeys is probably one of my favorites for guided imagery. Okay. And so what we're going to do, and I'm going to let Belle Ruth do this one for me. Not yet. Okay. So Belle Ruth Napperstack is one of my favorites. She's been doing guided imagery for many, many years and does a lot of different research on trying to help with many different conditions. She's currently doing a large study with the VA to help with PTSD and veterans. So a lot of great work. I call it almost like a self-cognitive behavioral therapy. So we're going to practice this. I will, just like Tyler said with consent, I will say that sometimes this can bring up some emotions, and if you do have any kind of PTSD, you might not want to participate. You might want to kind of try this on your own in a safe space. But anyone that does want to participate, I'd encourage you to join us and experience just a gentle relaxation guided imagery, okay? Okay, so I will let Belle Ruth introduce guided imagery and talk a little bit more about it.
I'm Belle Ruth Napperstack, and this is guided imagery designed to help you rest, renew, and heal. Guided imagery is gentle but powerful, and it can reach places inside of you that conscious thinking sometimes can't. It's been shown to help reduce anxiety, depression, pain, and fatigue, improve self-esteem and energy, and speed up healing while helping mind and body relax. Try to listen to this once or twice a day for several weeks. You'll find that over time it will have a stronger and stronger effect. Different parts of this will probably capture your attention at different times. Always feel free to ignore or change whatever doesn't suit you. Your unconscious mind will probably do that for you anyway. You don't need to pay perfect attention for this to work. In fact, your mind will probably drift in and out naturally. You may even fall asleep, and it will still have an effect, especially with repeated listening. If you notice your mind wandering, you can gently guide it back. And because this imagery is designed to help you relax, it's best not to play it while driving, but you can listen to the affirmations anytime. And don't worry if it brings forth some unexpected emotion. That just means it's working for you in a deep way. If you position your hands the same way each time you listen, this will become a kind of conditioning cue. Later, you'll be able to use it to move very quickly into a place of deep relaxation. So for now, see if you can take this next while to commit yourself to this process of engaging the power of your imagination to help you heal by gently immersing yourself in this safe and easy process. All you have to do is settle in, relax, and let yourself listen. To begin with, see if you can position yourself as comfortably as you can, shifting your weight so your body is well supported, and gently allowing your eyes to close. Becoming aware of the rise of your body as you breathe in, and the way it settles back down as you breathe out, so you can become more and more attuned to the feel of your breath moving in and out of your body. And now, taking a nice, deep, full, cleansing breath, and breathing out fully and completely. And with the next breath in, imagining that you're sending the warm energy of your breath to any part of your body that's sore or tense or tight, and releasing the tension with the exhale. So you can feel your breath going to all the tight, tense places, warming and loosening and softening them, and then gathering up the tension and breathing it out, so that more and more you can feel safe and comfortable, relaxed and easy, watching the cleansing action of your breath, arms and legs loose and comfortable, tension draining from fingers and toes, and any unwelcome thoughts that come to mind, those too can be sent out with the breath, released with the exhale, so that for just a moment your mind is empty. For just a split second, it is free and clear space, and you're blessed with stillness. And any emotions you're feeling inside, those too can be noted and acknowledged and sent out with the breath, so that your emotional self can be still and quiet, like a lake with no ripples. And now, imagining a place where you feel safe and peaceful and easy. A place you used to go to, or go to now, or someplace you've always wanted to be. It could be by the ocean, or in the woods, or up in the mountains, or desert. It doesn't matter, just so it's a place that feels good and safe and peaceful to you. And allowing the place to become real to you in all its dimensions, looking around you, enjoying the colors, the scenery, looking over to your left and over to your right, and feeling whatever you're sitting against or lying upon. Whether you're leaning against a friendly, wide oak tree, or surrounded by sweet meadow grass, or walking in the woods on a pungent carpet of pine needles, or you might be at the shore with cool wet sand oozing between your toes and gentle waves lapping at your ankles. Or maybe you're just sitting on a nice warm rock in the sun and listening to the sounds of the place, birds twittering, or the rustling sounds of a soft wind through the leaves, or the gentle soothing sound of a bubbling brook. Just so you're letting your ears become attuned to all the beautiful sounds of this place that is so safe and peaceful to you. And smelling its rich fragrance, whether it's the sharp, bracing scent of salt sea air, the sweet, heavy fullness of meadow grass, the pungent dark green aroma of peat moss and pine in the forest. Sometimes the air is so laden with scent, you can practically taste it on your tongue. And noticing the feel of the air on your skin as it caresses your face and neck. And it might be crisp and dry, or balmy and wet. So you're just letting your skin enjoy the wonderful presence of this place that is so safe and peaceful to you, and letting its healing presence caress you and soak into your skin, letting it fill you, permeating muscle and tissue and bone, calming and soothing you all the way down into each and every cell. So with every breath, you're inhaling the nourishing beauty of this place, breathing it into your body, letting it soak into every part of you, all the way down into your arms and legs, fingers and toes, infusing your whole body with peace and calm, able to feel the energy of this place, forming a gently vibrating cushion of energy all around you, softly surrounding and protecting you, becoming more and more palpable. And inside the cushion, you can feel safe and protected, relaxed and easy, able to take in whatever is nourishing to you, but insulated from whatever you don't want or need. And now, imagining that this cushion of energy is drawing to it all the love and sweetness that has ever been felt for you by anyone at any time. Feeling it pull in all the caring, all the loving kindness that has ever been sent your way. Every prayer and good wish, every smile and gesture of gratitude, filling the field of energy around you, pulling it all in like a powerful magnet, calling every good wish home, and so increasing the powerful protective field all around you, and perhaps sensing the presence of those who have loved or nurtured you, those who love you now, or who will love you in the future, just the ones you want with you, and sensing them around you now, people from your life, alive or long gone. There might even be a special animal standing guard. Dear old friends, visitors, some remembered, some forgotten, or a grandparent, or a powerful ancestor whose banner you've carried, a teacher, a guide, sweet spirits, magical beings, guardian angels, some familiar, some not, it doesn't matter, just so you feel their protection and support. You might even catch a fleeting glimpse of somebody, maybe noticing an old familiar scent, or hearing the unique timbre of a dearly loved voice, possibly sensing a presence at your side, or just behind you, or feeling the soft weight of a gentle hand. And one might lean in to share some words of encouragement, and others might just be there to keep you company, signaling their reassurance and seeing to your well-being. And suddenly you are certain, you know with your whole heart, your whole being, that all is well, that you are surrounded by protection, seen and unseen, with you all the time, whenever you choose to notice or acknowledge their presence, and that you are better for knowing this. Feeling all through your body the warmth of this awareness and the strength and calm that it brings, attuned to the peaceful stillness at your center. And so, feeling relaxed and easy, arms and legs loose and heavy, while you continue to breathe in and out, strong and steady, still aware of the special place, the cushion of energy, and the support all around you. So very gently and with soft eyes, you can allow yourself to come back into the room whenever you're ready, knowing in a deep place that you are better for this. And so you are. To begin with,
There we go. Okay, I hope everybody feels a little bit more relaxed and calm, and hopefully you learned a couple things from the last 2 hours that you can take out into your daily practice and start using to hopefully keep yourself from that burnout that I know is way too common for all of us. So, anyone have any questions for Tyler or me? Okay, good. Thank you.